Hi, everyone. Microphones seem to be working. No loud noises. That's a good sign. Yes, I'm going to be talking about screening today, primarily skin screening because that's my area of interest. Though I do want to say that this event is very personal to me. One, because I'm trained to be a dermatologist, and so skin cancer screening is very important. But also, my father-in-law died a couple of years ago from prostate cancer, and so together this event is very close to me, and I think close to many of you. So I'm going to try to advance my slides. Success. So first of all, brief introduction. What is dermatology in general? Well, we treat hair, nail, and skin conditions, which include skin cancers. And it's important to mention that skin cancer can affect anybody, regardless of skin color, race, or ethnicity. I think there's kind of this view of skin cancer affecting lighter skin tones because they get sunburned because that leads to skin cancer, but that's not necessarily true. And then again today, throughout the talk, I'm going to emphasize some of the skincare basics that you can do for yourself to screen for skin cancer. So similar to the prior talk, in melanoma there are health disparities. In all health, there are health disparities. And we know that melanoma between white people and black people, they're different in terms of outcomes. So white people, after melanoma is diagnosed, their 5-year overall survival is excellent. It's 94%. That varies based on the stage of the melanoma at the time of diagnosis. But we see that for black patients, the overall survival after 5 years is 70%. So there's a significant difference there. And one of the reasons is because unfortunately, black patients have a history of presenting to their dermatologist with more advanced melanoma, and that's due to many issues, including societal issues. Again, black adults, melanoma presents in later stages, and then my goal today is to help individuals screen themselves for skin cancer lesions that could be considered concerning for skin cancer early. So we think in dermatology about the ABCDEs of melanoma. Has anybody heard of this before? A couple? All right, a few. A dermatologist. All right. ABCDEs, these are kind of rules to live by for dermatology. So A is for asymmetry. If half the spot doesn't like the other half of the spot, we'll go through examples of all of these. B is for border. A normal mole, for example, has a smooth border, but if there's an irregular border, a scalloped border, or there's poorly defined border, you don't see a clear end to it, that's concerning. C is for color. Any spot that has multiple colors, brown, black, pink, red, yellow, anything that's not matching the other spots, then that raises concern for us, skin cancer or some other condition. D is for diameter, meaning the rule we kind of follow loosely is that a spot may be greater than 0.6 centimeters. But generally, if a spot is larger, it's more concern. And then E is for evolving. I'm sorry that the bottom is a little bit maybe hard to see for everybody, but it means that it's changing over time. So if it was flat, now it's raised. If it was asymptomatic, didn't cause any problems, now it's itchy, tender, bleeding, anything like that. So let's go through some examples of this. Asymmetry. Here's a spot on the arm of somebody. You can see that if we draw an imaginary line through it, it wouldn't match up on the other side. The mirror doesn't fit. So this would be a concerning spot that we would want to biopsy to rule out melanoma or some other skin cancer. Border, here if you can see, there's a very dark spot on the foot of someone with darker skin, and that there's this light brown area radiating out of the center of that spot. That would be concerning. Here's the lesion with multiple colors. We see some dark brown, we see some black, we see some areas where it's more pink and more red. This also would be concerning. Here's a spot with a large diameter. You can see there's a ruler on the bottom there that's marking out centimeters. So this spot is approximately 2 centimeters in size. Again, one of the ABCDEs we look out for. And then evolving. So here's a spot that was flat. Let's say 6 months later, you notice on your leg that it's now got a raised portion. And in fact, you can see that it's not symmetrical, that there are multiple colors there. So all these spots that I've shown would be concerning for melanoma and would be biopsied in a dermatology clinic. Some examples of this, particularly in skin of color. Melanoma we know is most common in patients with skin of color on what we call ankle surfaces, with like the palms of the hands and feet, the soles of the feet, as well as the nails. So you can see here that there are these dark flat spots involving these skin areas that look not like the normal skin, and it meets several of these ABCDEs of development. Here's some additional spots. You can see that the one on the right has an area where it's eroded, where there's blood coming out of it. So this would want to be evaluated urgently. Here's a spot where, again, more features that would concern us. So they can affect the nail bed as well, which was a photo that I showed earlier as well. So it's important to note that people can have non-melanoma skin cancers as well. Some of those skin cancers we're going to hear more about today. There's a patient here today with Merkel cell carcinoma, or history of Merkel cell carcinoma, and this is what we see on the far right. This is classically thought of as like a red-purple spot. It can be quite aggressive, and so it's very important to recognize this early. And then squamous cell carcinoma is also common, and this is can have various different appearances. On the far left, you can see that it's a broad area. It's rough. It's probably tender. But then in the middle, it's the same kind of skin cancer, but it's propped up. It's got this like pushing out character, and then it's got some scale on the top. So all these spots would want to be biopsied. So what happens when, say, you notice a spot like that and you go into the dermatology appointment? What happens? So a dermatologist will look at the skin, the area that you're concerned about, and then we'll use a tool called a dermatoscope, which you can see on the right, where it's kind of like a magnifying glass meets a flashlight. And so we use that to look closer, and we can see these features more clearly defined when we look at them with the dermatoscope. Then if a biopsy is warranted, there are 3 different ways to go about it. The most common is to do a shave biopsy on the far left, which is where we use a thin razor blade to scoop out the spot so we can get a full view of what this looks like under the microscope. We can also do a punch biopsy, which is where we take like the core out of the skin lesion and look at deeper aspects of it underneath the top level of the skin. And then on the right is an excisional biopsy. We don't do these as commonly, but it's where we cut around the spot, including some normal skin, and then it's ultimately sewed back into a straight line. So then they did the biopsy. What happens next? It goes to the dermatopathology lab where they look at it under a microscope. This is my poor attempt at making an avatar of myself. So this is a specialized doctor that looks into the microscope to make a diagnosis of skin cancer or not. And once these determination is made, then the results will be sent back to the dermatologist or the doctor who did the biopsy, and then they'll follow up with you to discuss the next steps. I want to put a plug in for the Ypsilanti Health Center, which now has a dermatology clinic in it. I put the address. Well, we actually have some flyers at the front. So if you didn't grab one when you came in, there are flyers at the front with some additional pamphlets and information about this clinic. Some of the doctors that work at this clinic, one of which is here today, Dr. Sal in the back. And then we have Dr. Fossman, and in the fall, we're going to have Dr. Blair Jenkins, who's coming to us from Columbia in New York, who's going to be joining our faculty here this summer. So in summary, the main takeaway I want you to have today is to perform intermittent skin exams of yourself. Get to know your skin. What kind of spots do you have? What kind of spots have been there forever? What kind of spots are relatively new? If you have skin of color, look at the palms of your hands, look at the soles of your feet, look at your fingernails. Do they look like other people in your life who have spots like that, or are your spots kind of unique and different? And if that's the case, then bring that up to your primary care doctor. If you don't have a primary care doctor, do engage with a primary care doctor, because then they can help oftentimes treat or biopsy a spot if there's concern, or then refer you to a dermatologist so you can be seen. Ultimately, it may require a dermatology visit, but that's not always required. So that's all I have. Thank you very much. Go Blue.